Hi, everyone. Welcome to our November SimCity rounds. It is with great pleasure that I'm going to introduce our two presenters today. First up, we have Betty Batel Yibrehu, who is currently in Nigeria, but is gracing us with her presence regardless. And she's a third-year general surgery resident at the University of Toronto. She obtained her MD in the Community and Urban Health track from the George Washington School of Medicine and Health Sciences in Washington, D.C. Her clinical interests include surgical oncology and minimally invasive surgery. Her community engagement interests include global surgery and diversity in medical education. And then we have Dr. Bondzi-Simpson. Adam is a fourth-year resident in the General Surgery and Surgeon Scientist Training Program at the University of Toronto. Born in Toronto but raised in Nigeria, he completed his BSc in Health Science at Brock University in 2013 and subsequently the MD MSc at the University of Calgary through their Leaders in Medicine program. Adam's advocacy and research passion is around health equity, which we're going to hear more about today. Currently, he is completing a PhD in clinical epidemiology and exploring disparities in colorectal cancer surgery in Ontario. He is the co-founder of the UpSurge mentorship program. So without further ado, I'm going to hand it over to you all, and thank you again for being here today.
Thank you so much, Dr. Abdul, for the kind introduction. I'm just going to share screen, and Betty was going to say a couple words, and then we'll get started over here.
Yes, thank you again for the warm introduction and for giving us a platform to talk about UpSurge. As you mentioned, Adum and I are co-chairs and co-founders of the program, and we're looking forward to sharing how we feel like simulation can be used to advance health equity by telling you the story of UpSurge.
Thank you. So we'll start with just a land acknowledgement to recognize that the City of Toronto, although we're meeting today virtually, but where it's a place where most of us are working, is the traditional territory of the many nations, including the Mississaugas of the Credit, the Anishinaabe, Chippewa, Haudenosaunee, and the Wendat people, and now is the home of many diverse First Nations, Inuit, and Métis people. The city acknowledges that Toronto is covered by Treaty 13 and was signed by the Mississaugas of the Credit. And so, as Betty had mentioned, the goal of really today, what we're hoping to discuss with you folks, is to give you an overview of what UpSurge is, a little bit about our journey in terms of a diversity initiative in surgery. We want to explore the role that simulation has played in our programming, and more broadly discuss how simulation as a whole can be used as a tool in the health equity and in diversity space. And then later we'll plan to do a little reflection, and we hope that this is interactive and we can discuss how sort of we as a group can use simulation to further advance equity in our local settings. So what is UpSurge? It is a diversity program that Betty and I co-founded back in 2020, really in the context of the George Floyd murder and the social awakening that happened across North America as a whole. And UpSurge is started out as a mentorship program for medical students that want to explore an area of surgery. And really the whole goal of UpSurge is to stimulate interest, to provide support for students, as well as guide them on their journey to becoming a surgeon, as this journey is quite long and winding and taxing, and there can be several road bumps along the way. So really mentorship is really a key factor for a student's success. And so we have a little bit of a little video that we have just to explain what UpSurge was, and I'll play that for you folks here.
Surgery is the practice of healing with your hands and improving people's health. Surgeons use cutting-edge technology to deliver safe and effective care to their patients. It's why patients place their trust in them. Toronto is Canada's beautiful and multicultural epicenter, and our surgical department should reflect the city's incredible diversity. But here's the thing. As we, the students, residents, and staff, move through our surgical department, we know that increased representation and support will make us as strong as possible. The UpSurge mentorship program at the University of Toronto We're facilitating a new commitment to diversity and inclusion by supporting historically excluded students interested in surgical careers. The program facilitates networking opportunities with surgeons who are active mentors and allies. We are Black, Indigenous, and people of color. We are from various socioeconomic, sexual, religious, and ethnic backgrounds. We are doctors, future surgeons, and we want to welcome you. The path towards becoming a surgeon is long, winding, and taxing. The personal and professional rewards are vast. It takes preparation and perseverance to execute any surgical operation. And the best and brightest students capable of walking this path come from diverse backgrounds. The time has come to carve out inclusive spaces. Are you scrubbing in? Let's begin the UpSurge. Surgery.
So that's a little bit of a background of how we started, and sort of there's a little funny story that if there's time at the end we can discuss about how we made the video and we kind of scrapped together the funds and kind of went to TGH on a weekend and just started filming. But so that's what UpSurge is really all about. It's a mentorship program for students, and this is our team for which hold the bulk of the work, and really over the last 2 years have been involved in the programming. And so myself, Betty, we've got representation from OBGYN, who's Nora, who's a PGY4 at U of T. We've most recently got a work study student through our relationship with the Office of Access and Outreach. So Nawal, who's a second year biophysics and chemistry student who's a part of our UpSurge team and helps out with some communications and things like that. Kennedy, who's a vascular resident, Elliot in general surgery, Chantal, and Ty as well. So we've got a team that really is, without having their efforts on a day-to-day basis and weekly basis, we wouldn't be able to run the program. So just want to recognize our team. From an organizational standpoint, so mentioned that our program really started as a mentorship program, but we have several different arms. And so at the bottom here, you can see all 4 of our arms. Mentorship was essentially our flagship of the program for medical students, but throughout the years, we've developed a community outreach platform as well for elementary and high school students, recognizing that the path to a surgeon is far upstream of medical students. We're also involved in writing up some of the work that we've been doing from a qualitative and quality improvement perspective. And our last arm is sustainability, which is around our social media and grant support and team recruitment. And really the organizational structure here is just to show that we're embedded within the Department of Surgery, but we have a lot of collaborations with other mentorship programs and other programs within Temerity Faculty of Medicine and the University of Toronto network sort of as a whole. So we've been involved in some social media, and there's a social media presence. And part of the idea behind this is we wanted to be able to demonstrate for the students and, you know, for them to see what life of a surgeon is really like. And so last year we did a day in the life. We continue to do a day in the life series where residents from various surgical backgrounds will really explain and kind of, you know, get their little kind of influencer blogger on type of thing where they'll document themselves on a typical day. What's a typical day like for a plastic surgery resident or vascular surgery or orthopedic surgeon? We've also had the chance to get a day in the lives with attending surgeons. So Dr. Sabrar, who was our program director, did a great day in the life. And most recently, Dr. McCaffrey, who's an OBGYN at St. Mike's, did a day in a life but she did a week in the life where she took us from the OBGYN clinic to the operating room to you know, her kids' swimming lesson classes, and just sort of show that whole picture of what it's like to be a surgeon. We've also done a couple of events in terms of during Pride Month, and we've done Welcome to Clerkship series where we teach the students how to be a successful clerk and give them advice in terms of how to succeed for performance on electives. And so some of that hidden curriculum piece that is really important for mentorship for students as they go through the programming. In terms of the mentorship program proper, so we started it in 2022, was our first original year-long mentorship program. And through this time, we casted quite a large net. We invited students across Canada, as well as international medical graduates, that identified that they were what we describe as underrepresented in medicine. And it's an umbrella term that is initially derived from the States, but we apply it to those that come from visible minority backgrounds, people that come from immigrant families, rural backgrounds, lower socioeconomic status, and more. So we asked students to identify, and we found that taking this approach has been a lot more inclusive for our program. So our first year we had nine IMG schools represented and 11 Canadian medical schools represented, around 70 medical students overall, and mentors from all around the city of Toronto and some in the greater Toronto area and Mississauga and Barrie and Oakville, etc. So we had representation from all the surgical sites as well. In 2023, hopefully maybe owing to the fact that students had a good time in the program, there was increased interest in the program. So we had 120 mentees from 13 Canadian medical schools and 20 IMG schools across the world. That a lot of them maybe are perhaps doing research or working part-time, but want to get back into residency. And we felt as if it was important to include IMGs because the path is so unique, and really mentorship is key from that perspective in terms of developing the relationships that can get you into a residency program. So we're happy to have increased interest in our second year, which is currently going on right now. And the feedback from the students, we've just provided some illustrative quotes here, but really the main takeaways were that students felt supported. It felt as if they were able to navigate through residency, navigate through CARMs, and navigate through developing relationships that would be important as they try to match for a residency spot. So these are just some illustrative quotes to highlight that. And so I'll pass it on next to Betty, who's going to speak to you folks about UpSurge and simulation.
So thank you, Adum, for kind of summarizing a very busy 3 years very nicely. So hopefully everybody kind of understands the various approaches that we've taken to establishing our program, in particular the mentorship program, and how we've tried to build a real organizational framework and have some continuity in the services that we offer. Simulation has been a really big part of how we've reached out to students. And our approach has also had to deal with the fact that we were a relatively new organization for the past year and a half or so. And so our two-step approach would usually be to find a collaborator, and oftentimes a collaborator who's a bit more well-established, has either a network that they've built over many years, for example, the Black Student Association at U of T, or even networks that are a little bit smaller and newer, but are already established, which would be the Diversity in Cardiology Education Initiative, which started just a year before UpSurge, but had a close-knit group of mentees that they were working with who we could reach out to for our programming. And then sometimes it's an attending who has an idea and reaches out, and we're always happy to collaborate with new people. But finding a collaborator not only allows us to broaden our net of people that we're reaching out to, we learn so much from our collaborators as well about how they run events and basically can maintain a partnership thereafter. And so once we've chosen our collaborator, we also kind of decide what our target level of activity is. As simulation can span high fidelity and low fidelity, having that conversation upfront really allows us to target like students and market it accordingly. But we always keep in mind that we feel as though anyone can learn anything. And when we look to some examples of non-expert background events we've done, on the slide, you'll see where you see the yellow gowns. Those are fifth graders from a TDSB elementary school. And they came to Mount Sinai through a program we did in collaboration with Dr. Aaron Kennedy to basically show them what it's like to be a surgeon. So at the Mount Sinai Simulation Center, they came for 3 hours of programming, which is a lot when you're 10 years old. And you can see that it wasn't necessarily like low fidelity models that they were working with. They're trying their hand at the laparoscopic simulators, they're doing bowel anastomoses, and they're learning from senior residents in surgical specialties, in particular general surgery, attendings, and also nurses and anesthesiologists. And they were also able to take a visit to the operating rooms and kind of see what things were about. And so, although, 10-year-olds can be very smart, this is definitely a non-expert audience that got to have a really wonderful simulation experience with the goal of exposing them to careers in medicine, bringing them into a hospital environment, and also like having fun, which is what they did in their little outfits and their scrub caps. And then the picture on the right-hand side for me, left-hand for you guys, I think, is an event from this summer. And this is with the summer mentorship program that's been organized at U of T for many years that targets Black and Indigenous high school students. And in this case, it was a suturing workshop that we did. And we're now at the point where UpSurge has a broader network of residents from diverse backgrounds as well that we can kind of call in to be mentors and teachers at these events. And so we have a neurosurgery resident here who's showing the students how to do suturing. And again, non-expert audiences that had a great experience. And when we think about, the extent to which simulation can work and the technology we have available, sometimes the goal is to bring that to as many people as possible. But when we reflect on these events, we feel like even the low fidelity models can be successful, and we shouldn't be afraid to bring those high fidelity models to non-expert audiences. And when we organize our events in a way that, takes into account attention span for our younger audiences or skill level for the older audiences, you can engage anyone. And anytime we host an event like this, the feedback is always that people want more. When we solicit that feedback, because we try and document what students feel as much as possible, that's exactly what we see documented as well. People really, really enjoy these events. They ask for more time at stations, more opportunities to do this. Some people even suggested coming in on a weekend so that it would be uninterrupted by nightfall, essentially, for these events. Having in a given event a broader kind of range of complexity so that students can, or learners can self-select where they go, as opposed to making it set stations as well. And then when we look at what the feedback is for our more expert audience, we can look at events we've done with our medical students. Again, we've done suturing, knot tying, wound repair events in collaboration with the Black Medical Student Association that you see on the left. But on the right, we had access to the Michener Institute's High Fidelity Models and Training Center, and we hosted an event in collaboration with a partner group, DICE, as I mentioned, Diversity in Cardiology Education. And this event was a huge success. Some of the different stations that we had included bowel anastomoses with pig bowel. We had our FLS, so Foundations of Laparoscopic Surgery, the trainer boxes, as well as the activities. We had vascular anastomoses, and we had our cardiac surgery and vascular surgery residents taking the students through that. And the students were mostly second-year medical students. We also even had a few undergraduate students and community members, so completely non-medical background in attendance, and everybody was able to be coached through these events. For many people, it's their first time being in a operating room-like setup or experiencing simulation. And the feedback was incredible. Again, people want more, people really enjoyed, people learned. And for students in particular, what we hear is that they often struggle with feelings of being intimidated by trying new skills in front of others. And these events create a safe place for them to do that among peers, and oftentimes peers of similar backgrounds. And it's really a great way for them, if they have the skills, to refine them, but also to build their confidence. And when we have surgeons or faculty come into the events to help, facilitate teaching, it's also a great way for them to network. And you see them shaking hands or trying to talk to our program director, Dr. Barr, who's come to support our initiatives in the past. It also is a great way for him to meet future students as well, or future applicants, I should say. So those are some of the examples of what we've done, but we also think to the future and think bigger, and want to highlight some other examples of how simulation can be used to address and increase representation in medicine. Many people have heard of the leaky pipeline used in a variety of contexts, but as it applies to UpSurge, we think about how as early as kindergarten or even preschool programming, students or children, I should say, begin to, I guess you could say, leak out of the pipeline towards paths in medicine. And so addressing this issue cannot be done through any one simulation event, but when used correctly, simulation can be a tool to patch up holes in this pipeline. And I know from my personal perspective, when I think about when I was in elementary school, the number of classmates, people that I was friends with then who even went on to do university is not the same compared to when I completely moved out of that neighborhood. And this was back in the time where students were put into academic or applied streams in TDSB high schools. And there was always a very clear racial, socioeconomic, immigration-based divides in who was streamlined towards the applied versus who ended up in the academic programs. So I definitely feel and understand this from my own experience. And when we think about an example of a program or a university trying to address this, we have this example at the University of Michigan. Basically, their residents identified to the program that they felt as though both the resident and medical student learner bodies weren't diverse enough to match the community that they serve, but also just based on national standards. And the program took that to heart and implemented something that's now called SimFest or Simulation Fest. And essentially, I did my medical school in the States, so I'm very familiar with something called the SNMA Annual Medical Education Conference. We call it AMEC. And it's basically an annual conference where student chapters from across the country, the United States, are invited to come. And the organization is not strictly for Black students. It's just happens to be mostly Black students, racialized students, people who feel comfortable in Black communities. They have a really large annual conference, and they, being the University of Michigan, opted to sponsor Simulation Fest, which was a 2-hour session that they hosted annually with multi-departmental participation geared towards medical students of all levels with a little picture on the side. And they've studied the impact of this. And basically over a 3-year period, they surveyed about 800 students who participated in this program. They surveyed 461 of the 800 students who participated in some capacity. And they had, as one may expect, excellent feedback, both in terms of being able to expose students who are, again, mostly racialized, to different specialties, to attendings, to residents, but also to the University of Michigan itself. One thing they noticed is that students who weren't previously thinking of applying there definitely considered it as a program to apply to thereafter. And the picture on the side are just some quotes that were included from student participants in and of themselves, which again highlight how impressed they were, their great experience, and the impact that the opportunity to participate in SimFest had. And although Adum and I are both general surgery residents, so we're so biased towards surgical-based simulation, these are the examples of how different simulation opportunities or stations, I should say, were brought to this event. And I think this highlights a few things. Number one, how varied simulation can be, but also how much multi-departmental support there obviously was for facilitating this, because it required annual volunteers from a variety of specialties every year. And from the student perspective, how nice it must be to just show up in one event, meet people from all these different specialties, and get to try so many different things. Outside of the benefits to students, they of course asked the faculty about the impact on them. And some of the excellent kind of points that came out were that the faculty learned so much from being able to be in these spaces with students. They felt like, just in terms of learning something new, over 66% felt like they had learned more about students from marginalized backgrounds, in particular, the barriers that they face that faculty might not have understood. And they also noted that faculty felt more motivated to participate in future diversity and inclusion initiatives because of the experience they had with Simulation Fest. Again, a one-day initiative or 1 day commitment, I should say, on the part of the faculty, not the organizers. And it had such a positive effect. Some of the quotes from the faculty are included in the picture there, which kind of echoed what I've explained about the impact of the program. And I think when we think about this Michigan example, we should, and we do ask ourselves, Aduma and I, like, what elements of this could be brought to Toronto? And I think what really sticks out is the fact that they inserted themselves into an existing event where they knew who the clientele or who the participants would be, and they chose to target that group in that way. And when I think in our context, what are similar kind of events that exist that we as people interested in simulation can participate in? I think about how there's increasingly annual meetings for groups who are marginalized. So there's the Indigenous Physicians of Canada, which just hosted, I think, their first annual meeting a few months ago. There's the Black Medical Student Association. The Black Physicians of Canada just had their first annual meeting. And even broader than that, things like Ontario University Fair, right? Because we're talking about a leaky pipeline. It doesn't just need to be medical students that we target. It can be high school students who are thinking about their future careers. So inserting yourself into an existing event is possible. Having multiple specialties represented is another kind of element of success that would be very useful. And then trying to make sure that it's an annual commitment so that you can build up interest and enthusiasm over time. And there are other examples of this that Adum can share with you as well.
Thank you, Betty. Yeah, so just on the conversation about the leaky pipeline and trying to go upstream and using simulation to address disparities that we see in terms of representation of minority groups. So the University of Texas Medical Branch, and this was a recent initiative, started out a program for simulation for high school students, recognizing again, and these are some of the statistics coming from the American context, for instance, that the rate of African American full professors is 2.7% compared to 88% of their white counterparts. So this was a program that was run out of the Laboratory for Surgical Training and Assessment in Texas, and the program's setup was that they wanted to target at a high school that was a majority of underrepresented students. So they went to a school in Houston that had 98% enrollment of minorities. And that minority word is used quite often in the American context. We might say more recently in our Canadian context, we might say racialized. So this high school particularly also had a 74% graduation rate, with the mean graduation rate in Texas being upward nearly 90%. So you could tell that this was a high school that was in an underserved priority neighborhood, with some of the other statistics there being 21% of those in that high school coming from a family that was in the poverty line, and in a community that 14% of the adults in that community graduated from high school. So it was really choosing a specific high school. The program itself occurred in 3 phases. The first phase was a lecture where a staff that came from a minority background delivered to the students at their high school, outlining what a career in surgery is like and all of the steps prior to get there. So we had that diagram earlier in terms of the leaky pipeline, talking about how do you get into college. When you're in college, what things do you need to do to get into medical school, including the MCAT. When you get through medical school, how to get into surgery, etc. So really came in to meet the students where they were at in their high school to talk to them about what a career in surgery is like. After that component was finished, the students that expressed that they would be interested maybe or in a career in medicine or surgery were invited to the University of Texas Medical Branch, where they did a 4-hour simulation that included knot tying, suturing, laparoscopic transfer of pegs, and a simulated colonoscopy as well. And then the last phase was they did a survey afterwards to determine what the student engagement was like. So this was the survey results. And as you can see here, so this is organized into the survey question, the student's scores, which was on a 5-point Likert scale, before the simulation session and after the simulation session. And when we look at those that had significant change between before and after, these were things like, I'm interested in pursuing a career in science, technology, and engineering. So 4.2, beforehand, there that score was about a mean of 4.2, whereas afterwards you saw that there was an incremental change in some of the students that were interested in those events. And so those are a couple of the other questions, including them feeling more confidence, including them interested in pursuing a career in surgery. And so really just to show, not necessarily you do one event and you change the life of a student, but it can at least plant a seed. And maybe Betty and I, when we started UpSurge, we said if we could just get one student that's interested in surgery or that's interested in cardiac surgery matched, that would be enough. So really it's planting those seeds earlier on and demonstrating that can be achieved. And so the takeaways from the Texas as well as the Michigan experience, and from our experience overall, is that simulation can be a very powerful tool to increase learner engagement, interest, and confidence, particularly students that may come from underrepresented backgrounds and not necessarily see themselves reflected in that profession as something that's an achievable goal. And then the second point really is that simulation can be used to advance diversity and inclusion, one for medical learners, as well as going upstream to those learners in elementary school, post-secondary school. And so the questions that we want to pose to you and to leave, maybe we can get into it a little bit in the question and answer period, or you can walk away with it. But what barriers exist to initiatives like these, like ours, the one in Texas, one in Michigan, in your own local context? And then the second part of that is trying to get an understanding of the lay of the landscape of the key stakeholders involved. So who are the key stakeholders that you want to engage with and partner with, and who has that community program already up and running that maybe you could perhaps insert yourself into and work with in order to improve equity and diversity in your own local context. And I'll pass it back to Betty, who's going to share a summary of today. Oh, I see Betty dropped off the call. I think sometimes she's there's little power outages in Nigeria here and there, so she might be back in a second. Yeah. So basically, over today's talk, hopefully we've shown you that some of the results of our UpSurge program in terms of stimulating interest for students, as well as how simulation can be tailored to any skill level. So we saw students that came with the yellow gowns that were, in grade 5 and had fun with it and really sort of planted that seed with them there early on, all the way up to medical students, all the way up to, as of course we use simulation as medical residents and fellows and trainees and staff. So, hey, Betty, I see you came back out here. We figured that you just dropped for a moment. So I just went ahead and finished the last slide. But with that, we thank you for listening. And we're hoping looking forward to hopefully maybe working with you folks more and hearing your perspectives of your own programs that you have in your own local context. And thank you, Dr. Abdul, for inviting us to speak and to share our experience today. We really appreciate it.
You're so welcome. And it's we who are appreciative, because when I first met you and Betty, I was like, we have to get the word out on this. We have to see how we can expand and ensure that there's sustainability for this very valuable approach. And my favorite slide, I just posted it on X, formerly known as Twitter, was that leaky pipe slide. It really is going to stay with me for the rest of the year and onwards, because it really identifies, from sort of cradle to the grave opportunities for us to really intervene and make an impact. And I love that you're doing that. And I also love that we have 20 minutes for some engagement, some discussion, and questions from those of us who made the time to attend today. So why don't we stop sharing slides so we can open it up? And I can feel the chat if you and Betty want to focus on questions. So Sarah Brenton is saying in the chat, thank you for such a wonderful presentation. I've been bringing simulation task trainers into my kids' school for a few years to strike up interest. And she wants to know if there are similar programs for other healthcare professions. Who wants to take that one?
By
So I
other
think-
healthcare professions, you mean like nursing, occupational therapy, or like just disciplines within medicine? I'm assuming the former.
Yes, sorry, thanks, Betty, for answering that. Yeah, anything other than like the medical learner per se, like any like physio, OT, nursing, any other programs.
So, I mean, Adum can jump in at any time. So, I mean, as far as I know, in my review of the literature in preparation for this presentation, there weren't too many simulation initiatives that were very clearly marketed towards other healthcare professionals. But when we think about exposing students who are undifferentiated, which are the high school and elementary students, to healthcare careers, I feel like when we're trying to capture them, there definitely is a role to do simulation targeted for these groups for these other specialties. Sorry, like my power went out. As I mentioned, I'm abroad.
You're abroad.
So,
I will add to that 2 weeks ago, we had our Bring Your Kids to Work Day, which is only open to grade 9 students at this time. But, you know, your presentation has made me wonder if there's opportunity for us to open it up even to younger grades. You had a grade 5 in your pictures. And certainly a simulation center is a safer space to bring younger kids, to expose them, you know, to interesting stuff and inspire them, hopefully. Walter Tavares wrote great initiative in the chat and his hand is up, so I'm going to stop talking and let him.
Before we get to Walter, I wanted to just jump in as well too. I think that Sarah's question was really excellent and reminds us how you know how many other people we also need to work with in these spaces. I mean, when I was looking on the Temerity Faculty of Medicine page, you know, I think sometimes as physicians we quite physician centric, but the Temerity Faculty of Medicine includes occupational therapy. So really, I think that as we sort of move through these spaces and develop more simulation programs, you know, reaching out to our nursing colleagues, I'm sure that they do have simulation because there's a couple of procedural skills that they'll have to use, like, you know, inserting IVs, inserting Foley catheters, you know, things to that degree. So I'm sure that they do use simulation, but you know, maybe when we're searching up on PubMed, it may not be, you know, because we're looking through our medical MD lens, that we don't necessarily see those.
Oh, sorry, it lagged. I was just gonna say, to add to what you're saying, like I can think in my mind of like simulation that's targeted towards students in ortho that could easily be applicable to PT or OT students. Things that's targeted towards anesthesia that would apply to nursing. So I think that probably the activities themselves exist. It's just that it's not being, as far as we know, through our biased lens, marketed in the same way towards these different groups.
Mm-hmm. So I think we had, I saw a hand from Walter and then Doug Campbell.
Yeah, thank you. And thank you for the presentation. Certainly learned a lot, and what a great initiative. I guess the question that I want to bring up was stimulated a little bit by a comment that Doug made earlier, and a little bit about this conversation about other health professions, is the scalability of the idea. You know, to what extent this could be, you know, packaged is not a fair way to say it, but you know what I mean, about whether there are principles or tips and tricks, or, you know, whatever it is that you can communicate what you're doing here in a way that would allow it to be scalable, particularly the EDI issues that you've been able to capture in this work.
Betty, you look like you got something for that one.
When you say scalable, do you mean like the simulation events or just EDI, like
No.
just for it to clarify?
I mean the concept, the idea, the structure, you know, because in this initiative, you have been able to, you know, capture the thing or structure it in such a way that it's achieved the outcomes that you were after. Again, particularly around the EDI issues is what really caught my attention. And I don't think we do that really well. And so there's a scalable option here where you could say to other sim educators, and this is again going back a little bit to, I think it was Doug's comment about, having this sort of show up in different places and giving people the knowledge or the principles or the guidelines or whatever it may be. I think some of these things lots of people are doing, and there's other things that are unique that I think could be scaled out, again, particularly around the EDI issue.
I feel like, I mean, I know you'll jump in, Adum. I feel like two of the things I should say that have really helped us with scaling this from an idea, a discussion to a program has been our relationship to the work that we're doing. We happen to be particularly motivated because Adum and I were like one of 2 of 3 Black residents in the entire Department of Surgery and OBGYN when we started. And we always made it open to like all underrepresented groups, but I definitely feel like the motivation, your familiarity with the issues, the perspective and the voice that you use to talk about it, and then also relate to students that you're trying to encourage to join. Sometimes you don't want to say it because it might sound discouraging to people who don't share your background, but I feel like it's almost like a little bit dishonest not to say that that has been a barrier in reaching this point, but an asset in trying to change things at this point. That makes sense. The other piece that I feel like has really helped with scalability is those partnerships that we've had with existing organizations, because I really don't feel like UpSurge would have been able to establish itself in the way that it has, which is not just as a mentorship program, if it didn't have collaborators early on that gave us events when we didn't really know how to have events. And that gave us a network when we didn't necessarily have the same reach or same access to students. And what we found is like now, because of word of mouth, other smaller student groups are looking to us to collaborate now. And there are bigger organizations that are aware of us who we can now seek to collaborate with. So I feel like just documenting who your partners could be and seeing 1 or 2 that you can reach out to or see who's having an event, then asking if they don't mind you being like a co-sponsor, co-partner in that are like some of the first steps that might be helpful.
Yeah, I don't have much to add other than to say, I think that for us, we tend to work within silos, and particularly as a medical trainee, basically all I know is when I'm at Sunnybrook, all I know is Sunnybrook, all I know is general surgery, and all I know is the Department of Surgery. But I think that once we started stepping outside of just our department and recognizing ourselves within the broader, Temerity Faculty of Medicine and then university network, that's when we've sort of been able to, as Betty has alluded to, sort of leverage some of those partnerships. And that's why I'm so happy to be here today with you folks who are the sim educators who otherwise, other than this rounds, I would have never sort of gotten to know really. So I think that this sim newsletter and sim rounds are really, really great. So yeah.
Yeah, I think, can I just add, Petal, thanks, Adum and Betty, thanks so much for such a great presentation. Your passion shows, even though it's been 3 years. I don't know how the heck you guys have time to do this at all. But it's really great. And I think leveraging partners is exactly, hopefully why you're here and hopefully why we're interested in working with you guys, because we really, like sim programs across the city, there's like 20 sim programs, right? Across the city, not just in academic health science centers, but in our community hospitals and as you know, now our allied health disciplines, like the nursing as a huge sim center, George Brown is one. And so I think what I would suggest is work with Dr. Abdul and others to sort of network with us, because I think each program's probably doing some activity, likely in different stages, maybe different communities being targeted. Like I'm working with some of our indigenous communities, trying to, get them in. It's outreach really, but it's a way to open some eyes. But for example, there's no reason why U of T shouldn't be sponsoring UpSurge to do a sim day across 6 centers across the U of T. Right. And that's just, and I think leverage us, like Dr. Abdul and me and others could work with, Dr. Houston and just say, listen, this is a no-brainer. We got to figure out, make this happen, right? And we'll do it. And I think taking your lead, taking your insights, and making sure we're doing it well, right? I think that's what this is all about to me. So I'm excited to get going.
Thank you so much for the feedback.
Thank you.
And Sarah at North York is also volunteering her services. So we have sim centers ready and willing to offer you space and opportunities to run this.
And the more the merrier, right? And take the workload off you guys because you're busy enough, right? Let the sim programs help organize, get the equipment, get some faculty, right? Because each of us have our own networks. And I would imagine there'd be some Black faculty and Indigenous faculty and others that would be more than keen to help out, right? It just, we don't know. And Sim's an easy kind of attraction, right? For faculty, residents. I mean, you guys know it's fun, right? So but the programs can do the work for you, right? You can be the face of it and we can collaborate with it. I think, just throwing it out there, but I think that's how it should be. We should serve amazing clinicians like you. And we should do better by our communities that are clearly marginalized and don't access it early on.
And
I love that because I think that as we, as we move along this process, Betty and I know what we bring to the table, what our expertise is. Like, we're close to the students, we know some of the knowledge material. But you folks know the Sims, and you folks know the resources, and you folks know the university structure and network, and so it fits for a natural partnership to help both of us.
Yeah, like just for example, like we work with a lot of women living with HIV who have babies, and we're not encouraging them to breastfeed. Like that would be amazing, Sim, right? Bring some of these patient partners in and work within a context so that it fits within your ideas and the curriculum in general, right? But CAMH could do something amazing, like North York could do something amazing. Like you're already working with UHN. Like I think we're here, I think, to help and to take some workload off, right? Not to add, right? So
I will say though, we don't have the laparoscopic Sims that
don't need it.
At CAMH we don't have that stuff.
That doesn't matter, right? Like
the grade 5 will be okay without the lap sim.
But like sign up, like there's no reason why Sinai shouldn't lead that part, right? We do just work in conjunction, right? It'd be a cool sim fest to run it. And there's different places everyone could have a big bus and you could bus people around on one. It'd be fun, right? Yeah. And it would be, and I guarantee you Dr. Houston would be behind it. It's just,
we need to bring her attention to it. And
what's she gonna do? Say no, right? So, and same with PG&E, right? So, honestly, it may be a small thing in some ways, but it would be a really fun event to sort of wake all of us up to the issues of racism in general and access, but also just more importantly, just bringing people together, and then you could form different groups and work with St. Mike's doing this, work with CAMH doing that if you want, right? Or let those individuals who are already leaders in those areas then flourish and use Sim as a tool to bring people together, because that's how I see it.
And I like your tagline, anyone can learn anything. Although when I tried out the laparoscopic thing at Michener, I moved one across in like 5 minutes. And I said, oh, I can be a surgeon. And then Jillian Frederick said to me, Petal, the surgeons do that in 45 seconds. They move 15. So maybe not anyone.
You stick to psychiatry, right?
I know, I'm gonna stay in my lane. Any other questions or comments for our wonderful presenters today? So like I said at the beginning, for those of you who missed, we are recording this and it's going to be embedded in our YouTube channel that has all our SimCity rounds. And we have a newsletter coming out at the end of this week, which will also have the link to this very important UpSurge story. And hopefully you can share it with others in your departments if you want to inspire others and get this ball rolling on some of the things that Dr. Campbell has shared. And another comment about great initiative and presentation. So I want to thank you again, Betty and Adum. You've really outdone yourselves, and we're so grateful for your time and your energy. And I hope we can continue to work together.
Thank you so much for having us. We appreciate, as we said before, the platform and the support, the questions, the enthusiasm. And we definitely look forward to collaborations in the future.
All right. Message me when you're back, Betty.
You'll see an
Take
email
care.
from us.
Bye.
Did it cut?